I'm Marianne Hedden. I'm with the Clinical Research Program of SGMC's Pearlman Cancer Center. We've been doing clinical research for the past 20 years. Most of our studies are sponsored by the National Cancer Institute, but we also have studies sponsored by pharmaceutical companies that have some promising new drugs to treat our more difficult cancers. This is, without a doubt, one of the most exciting times to be a part of cancer clinical research. We've learned so much about the biology of cancer in the last few years that's helped us understand why some cancers are more difficult than others to treat, why the same cancer can act differently in two different patients with the same diagnosis. And what we now know is that some cancers are caused by key genetic changes called mutations, or other abnormalities in our molecular makeup, and those changes trigger a cascade of events that lead to abnormal cell growth, and if left unchecked, it can proceed to cancer. But it's not only those molecular and genetic changes, it's also what we expose ourselves to over our lifetimes. Do we smoke? What do we eat? How many sunburns have we had, for instance? Much of our recent research has been centered on trying to pinpoint the specific genetic abnormalities associated with the development of cancer. We know that in some cases, specific cancers like breast, colon, lung, and some leukemias can be treated with a therapy that targets those mutations, and it makes a tremendous difference in the survival of those patients. But it's now evident that many more mutations than we originally thought are present in various cancers. And what we don't know is which of those mutations are important in driving the cancer forward, and whether there's a drug to target those mutations, and if so, whether that drug can make a difference in the survivability of the disease. So that's the whole focus of the National Cancer Institute's Precision Medicine program. They're rolling out a series of trials that will test a patient's tumor, match it to a drug that targets the abnormality, and then compare that drug to our current standard of care. This is an unprecedented collaborative effort between the NCI, the companies that do the molecular testing, the pharmaceutical companies that supply the drug, various foundations that support the effort, academic research centers, and community cancer centers like Pearlman Cancer Center. It truly is a public-private partnership in the best sense of that phrase. For patients who come to Pearlman that qualify for these trials, they can have their tumors tested free of charge, and if they receive an investigational agent as opposed to standard therapy, that drug will also be provided free of charge. This is the future of cancer medicine. Targeting what's unique about a patient's tumor to disrupt the process of abnormal growth. And we're excited to be a part of that process. It's precision medicine, it's cutting-edge care, and it's close to home. For more information, you can call the research office at 229-259-4628 or visit us online at www.sgmc.org and follow the links to our clinical trials webpage.